Hi everyone. So my name is Hatem Abdul Hussain. I'm a GP in Northwest London, and I am the clinical lead for Health Education England's Digital AI and Robotic Technologies in Education programme. The aim of this programme really is to think about how we can help prepare the NHS workforce from a digital readiness point of view for some of the emerging technologies that were described in the Topple Review that were published in 2019. So the Topple Review made some quite clear recommendations in terms of the types of skills that we need in terms of our clinicians, in terms of our scientists, in terms of our knowledge specialists and technologists, in terms of the emerging technologies such as AI and robotic technologies, but also wider than that in terms of the digital healthcare technologies that have been talked about today, for example, in terms of remote monitoring. And it's part of our overall business plan to ensure that we prepare for an agile and adaptable workforce for the future. So just to start with some basic definitions, the Topple Review defined AI as a broad field of science which encompasses computer science but also psychology, philosophy, linguistics and other areas, and essentially with the aim to have computers to do tasks that would normally require human intelligence. The Topple Review also described a concept of digital medicine. Digital medicine is defined as any digital products or services that are intended for the use of diagnosis, for prevention, for monitoring or treatment for a disease or condition. And this comprises of a range of technologies which includes telemedicine, smartphone applications, wearable devices, software such as e-prescribing, point-of-care tests, and also emerging extended reality technologies. So in terms of the DARTED programme, our overall aim is to start thinking about all of these technologies and how we prepare the workforce. And we have 3 core projects that are overseen by our governance in terms of our digital and education steering group. The first project is a focus on AI and digital healthcare technologies, and we've been working with lots of colleagues in that space. The second project is about robotics literacy and preparing our surgeons in particular for robotic surgery to ensure we have an equitable and aligned surgical workforce that's able to do robotic surgery, because we know it's a significant growing part of the way we deliver our surgical treatments. And then the final project we're doing with the British Association of Dermatologists around building dermatology digital leaders, and they have worked with us to have Topple fellows, who are some of our fellows that take some time out to do digital transformation, who are part funded by the British Association of Dermatologists. Today we're going to be focusing more on the AI side, and particularly the AI roadmap report and dashboard that we published a couple of weeks ago. So our approach to AI when we started this piece of work was to understand what's coming. So build on the work that was done in the Topple Review to do our horizon scanning. And we do that through 2 ways. One is by creating this roadmap that we're going to talk about today, but also trying to understand what do we need to do to make sure that healthcare workers are going to be confident in using AI. So what kind of factors do we need to consider? And that includes things like regulation, liability. It includes things at sort of user level in terms of the impact of that technology on clinical decision-making, clinical reasoning. And see, these are some of the concepts that we're exploring with our colleagues at the NHS AI Lab, and also with help from our colleagues at the Health Foundation. At the same time, we're doing some work around assessing learning needs. So one of my bugbears as a GP was I moved from, as a trainee and as an SD2 to an SD3, I moved from working completely differently. So initially I was doing lots of face-to-face consultations. All of a sudden I'm back in general practice after a stint in A&E, and majority of my consultations are remote. So how do I then best prepare myself to work in a completely different way? And I found that most of my curriculum and my training was lacking in preparing me to do remote consulting, for example. So we're trying to be proactive in this space and really identify what people need to know, so that can get lifted and shifted into curricula, into delivery of teaching. So we're delivering a capability framework with the University of Manchester, and that hopefully will be published early part of this year. That can allow us to at least identify what some of the learning needs are, and then target some of our learning materials in terms of what's already out there, what needs to be produced. And that's that final part, which is delivering education. But today, as I said, I want to focus on our AI roadmap. So our AI roadmap was published and was commissioned by us to be delivered by Unity Insights, who are formerly part of KSS Academic Health Science Network, and was led by the team, led by their Chief Services Officer, Marie-Anne Demesterhas, and colleagues. And what we wanted them to do is really build on previous work that they had done to really understand the landscape of AI technologies out there. What's there currently in the NHS, what's coming, and also understand some of the taxonomies around it, its sort of deployment, and it's also its workforce impact. So this is what we found. So just to quickly talk about the process around it, initially we did a piece of work in terms of identifying what are the key data sets that tell us what technologies are out there. So these were the NHS State of the Nation survey, the technologies that are applied to the AI awards and the innovation pipeline, as well as the NIHR Horizon Scan as well. So those became our sort of initial data sources to understand what's currently out there. And we wanted to think about working with our library and knowledge services to identify where the gaps were and where the limitations were. The next part was then to start defining the taxonomies around that. So I'll go through some of our taxonomies today. We then wanted to create this database and have an initial template for this database that people can use to really understand some of the things that we're looking at here. And we wanted to start to define what the workforce impact might be for these technologies. That's really system level, pathway level, and also then for the user themselves. Final part of that was to then create the dashboard, get the dashboard up and running and make sure it's accessible. Do some deeper dives, and we'll talk about that very briefly, and then producing the report around it, which we published a couple of weeks ago. So the first thing we did was look at the taxonomies, and this is a really clear picture in terms of what kind of technologies are currently out there in the system. Now, you won't be surprised to find that 34% of these technologies were really considered diagnostic technologies, so those that tend to be used in sort of imaging, diagnosis, etc. And a significant proportion of these technologies, in terms of 29%, were considered automation or service efficiency. So this is the kind of technologies that help us with some of our administrative tasks, but also things like clinical triage. But what we did find, and really interesting, I think really relevant to the conversation here today, is a growing list of technologies in P4 medicine and remote monitoring. So P4 medicine is those technologies that are predictive, personalized, participatory, and preventative. And these are the types of technologies that will help us to pick up disease earlier, help us to support our communities better as well. So this is really relevant when we think about the types of technologies that are going to help and be really insightful based on the data that we have at ICS level, for example. And in remote monitoring, we've had lots of discussion today about the impact of remote monitoring type technologies. We saw the presentation earlier today by Shani and her colleagues, and we saw the patient representative there, Barry, talk about that impact of remote monitoring and the insights that the data that he puts in and how important that data is accurate, because otherwise it can lead to problems, lead to sort of care issues. And that is relevant for any healthcare professional that's looking at that data or is inputting that data. But also thinking about the analytics behind that in terms of flagging up patients that are being remotely monitored and then kind of the pathways around that too. So clearly an emerging area in terms of AI and clearly one that we need to be thinking about too. Particularly for things like chronic disease, but also for patients that might be discharged from hospital, post-surgery, post-episodes in hospital for medical reasons. So, time to deployment, and this is quite interesting, because we had a quite strict time to deployment criteria, which was different to what's in the AI State of the Nation survey, where the people that are developing the technologies can actually rate it as 1 year, 3 year, 5 year. We had a bit of a methodology around that, which is described in the report, but what we found was that 56 technologies, so that's 23% roughly, excuse my maths if it's slightly wrong, were at least within 1 year away from deployment. So that means they're either currently deployed or they will be deployed within the next year. On top of that, we found that majority, around 86% of technologies, will be deployed within 5 years. So that's really important for us, because when we produced the Topple review, we created this kind of roadmap in terms of what technologies are coming and how far away they are. And we were expecting, AI to really start to impact the workforce and impact the way we work in about 15 to 20 years. That was the kind of roadmap that was kind of set out in the Topple review, if you look within that. But actually this suggests that it may be much sooner than that, and the scalability of these technologies is actually far greater than we initially thought. And it also captures, to some extent, what's happening in the NHS as far as we can say right now. On top of that, we started to look at workforce groups. So what we did is we mapped our occupational codes at Health Education England to the type of material that was put out by the innovators and the developers of that technology to identify what they believed were the target workforce groups when they're putting these technologies together. Again, you won't be surprised to see it sort of towards the top of that list, the radiologists, the radiographers, because majority of these technologies are diagnostic. And if we think about the priorities in terms of the NHS and the work that Dr. Tim Ferriss has put in place around increasing that diagnostic capacity in the NHS, we now know quite clearly that we need to target those specific workforce groups in order to help upskill and then prepare them and get them the right experience they need to be able to work with many of these technologies that are approaching their care. But also, more interestingly than that, I think what we found was some of the other workforce groups that we weren't quite expecting. So, for example, general practice right there is one of the core workforce groups at number 2. Other workforce groups like cardiology, but actually our administrative staff, our the fact that actually multiple roles were affected in many of these technologies. And then the other thing I would say is that there is a clear inherent bias in this. And this is something that's really important for those developing the technologies and innovators to make clear to us. Because if you think about it, more likely than not, they will be considering certain workforce groups in what they put out there in terms of material. But actually, let's talk about general practice, for example. I work in a significant multidisciplinary team with multiple members that all do very different things to help manage a patient's pathway. So actually, if we believe that general practice will be one of the most workforce groups to be affected, that actually means it affects the wider team. If we've got a clinical triage technology that's going to affect how the GP works, it's also going to affect how the physician associate works, or the paramedic, or the physiotherapist. And quite clearly, our administrative staff, our reception staff are quite, are really at the forefront of everything that we do. So how is it going to affect them? So this is really useful because it gives us an oversight, but what we wanted to do then going forward is take a deeper dive. So within the report, what we've done is we've focused on a couple of case studies. One of these case studies is a technology called OxyHealth, which is used on mental health wards, and the second one is on Optellum. And within those case studies, what we try to do is dive deeper by actually having interviews with those that have actually used the technology on the front line, by making sure that we have interviews with those that were developing the technology in the first place to truly understand what was that impact at pathway level, at system level, at user level. And quite clearly, we need to be doing this for really a lot of the technologies coming through to use that case study template. So we've been working with our colleagues at the Multi-Agency Advisory Service, that's LHIS, MHRA, to really think about how they build it into some of the work that they do when they're evaluating technologies and when they're trying to understand some of our future technologies. And I think that's a really interesting way to really delve out what's really going to happen, on the front line once these technologies are put in place. Then I think another really interesting area to explore is spread. And the reason why I think spread is really interesting to explore, because as we move to integrated care systems, as we move to sort of ICBs in terms of commissioning care and collating care in an area, we want to know what areas are more AI mature. So what areas are more capable of delivering AI technology at scale? And what we want to do is help them to have a look at and say, okay, this is clearly a problem that we have in our population that we need to tackle. We're quite interested in looking at remote monitoring or P4 medicine solutions, for example. Where do we know in the country that is already quite mature in its space or technologies already exist? So what you can do on the dashboard, and this is just a very basic spread of AI technologies across England, and you can see quite clearly there's a cluster of technologies in some of our urban areas, in terms of London, in terms of Birmingham, in terms of Manchester, in terms of Leeds. That is not a surprise, but actually what's important for us to understand is these technologies are going to be just as important to some of our more rural and remote areas. So how can we empower and how can we support as sort of a wider NHS sort of E&I Transformation Directorate, along with Health Education England, to upskill the workforce, to identify what you can do to take technologies that we know are validated or that are being deployed or that are working elsewhere and take them to other areas. So if you're interested in P4 medicine, you can go on the dashboard, you can click down to P4 medicine, and you can see what is the spread of those technologies across England. And I think that's really interesting because it will help to hopefully create a culture of what we want to achieve in the NHS, around collaboration, around innovation, around spread. I also wanted to just highlight that this is really a multi-team approach nationally. So we've been working quite, throughout this process, the team at Unity Insights did a significant piece of work around this and worked quite closely with all of our stakeholders really nationally. So this is being fed into some of the work around the AI strategy, which is being led by the NHS AI Lab. We've had quite a lot of conversations with our colleagues at the Accelerated Access Collaborative in terms of how they think about looking at how they look at the AI award technologies and evaluate those technologies and understand those better, and also build the evidence base around that. And similarly, our colleagues at NICE and MHRA are really interested at building that evidence base and really strengthening the evidence around the technologies, because at the moment this is all soft data. This is the first dashboard to our understanding that presents this information, but it is based on soft data. And so what we need to think about is in future sort of reiterative versions of this is to build in more evidence, and that's really important. Finally, taking it back to our focus, and our focus is the workforce. We need to make sure that we have a ready workforce to work with these technologies. And we know that to do that, we need to make sure we have the right educational materials, the right learning, and that really is relevant to all aspects of our workforce, our future workforce, so those that are still in sort of apprenticeship schemes or undergraduate studies or postgraduate studies, our current workforce in postgraduate training, for example, our dentists, medics, pharmacists, and also our general workforce that are, continually updating their sort of professional development, who will need learning in this space to work effectively with these technologies. So we need to consider all of these groups, as well as then finally, what do we do about that specialist workforce that we need to build around digital? And of course, there's lots of work that has gone around that in terms of the Digital Academy and so on. But what we're doing is building that capability framework with the University of Manchester and focusing on these areas and going into these areas and outlining what people will need to know in these areas. So this is the work that's been done so far in terms of mapping some of the areas that's going to be within that digital healthcare capability framework, ranging from digital transformation skills right from the start to the use of digital health with the public in terms of remote consulting, all the way through to data and AI. And this has been done with the University of Manchester through a systematic review, through stakeholder engagement, and we're now getting quite close to the process of finalising this framework and showing that to you. So we're really excited, and please do keep a lookout for that, because it will be really helpful for anyone, individual learners, to identify what you need to know, but also for some of our providers to identify and signpost to their staff and learners what they need to know. And finally, for us to work with rural colleges, for us to work with other educational bodies, to work with HEIs, to make sure that we get the right materials in future training pathways so that we have a digitally and data and AI ready workforce for the future. Thank you.